Welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper, and today I'm going to demonstrate a self-myofascial release and muscle energy technique for the anterior and lateral compartments of the lower leg, or the front and the outside of the lower leg. These techniques will address tib anterior, flexor hallucis longus, flexor digitorum longus, peroneus longus, and peroneus brevis. When these muscles are dysfunctional, they can lead to pain and restricted motion in the lower leg, ankle, and foot. For these techniques, you are going to need a foam roller or a lacrosse ball. While performing this technique, avoid rolling directly over the ridge of the shin on the anterior or front aspect of the lower leg. Start by placing the roller on the lateral aspect or outside of the lower leg just below the knee. Move the roller towards the feet, searching for myofascial trigger points or tender spots. When you locate a myofascial trigger point, pin it down with the foam roller for 20 to 30 seconds or until the intensity of the discomfort decreases. If you would like more pressure while performing this technique, cross the calf of the unaffected leg over the shin of the affected leg. To achieve the ischemic compression component of this technique, we are going to locate and treat 3 to 4 myofascial trigger points. To achieve the myofascial release component of this technique, we are going to apply force directly into the fascia in the tissue of this area for approximately 1 to 2 minutes. This technique can also be performed using a massage roller or lacrosse ball. Start by performing short gliding strokes on the lateral aspect or outside of the lower leg, just below the knee, from the knee towards the ankle, searching for tender spots or myofascial trigger points. When you locate myofascial trigger points, stop and pin them down with the lacrosse ball or massage roller for 20 to 30 seconds or until the intensity of the discomfort decreases. Once the discomfort decreases, continue searching for myofascial trigger points, treating 2 to 3 myofascial trigger points between the knee and the ankle. This technique can also be performed using a myofascial rolling stick. For the muscle energy technique, we are going to use a yoga strap, belt, or heavy resistance band. Start by placing a bite around the instep of the affected leg. Then step on the strap using the foot of the non-affected leg as a pulley to invert the foot and ankle of the affected leg. Pull on the running end of the strap, inverting the foot and ankle of the affected leg until you get to the first sign of resistance or the barrier. Hold this position for approximately 10 seconds and then evert the foot and ankle of the affected leg by pulling the foot outward for approximately 5 seconds with about 10 to 15% of your strength. Relax for about 1 second and then pull on the running end of the strap, increasing the inversion of the affected foot and ankle until you get to the next barrier or sign of resistance. Repeat this process 3 to 4 times.